This Pitch Breakfast video is brought to you by Spangler and Agins.
Today, my name is Blessing. I'm the CEO of ahoyDoc, and we help time-strapped doctors provide around-the-clock support through their website. And the problem is doctors' websites, patient portals, they're boring, they're stagnant. No one uses them because they're not engaging. And how we change that is we put a live human on your doctor's website where you can talk to them 24 hours a day. And you can book appointments, you can upload prescription refills, you can upload medical documents. We're currently in a $4 billion market, projected to grow to $6 billion by next year. Our competitors include live phone operators that are very expensive and not scalable, and then other live chat services which aren't fully staffed. We're currently raising $500,000. That's to grow our sales force. We're looking for strategic partnerships with health software companies like EHR vendors and website developers, and then we're looking for strategic acquisitions like medical website hosting companies, and other website developers like the one we currently have pending, which will add 150 new websites to our network by the end of the year and drop about $150,000 to our bottom line. And that's ahoyDoc. Wow, I'd really blazed through that one. You told me I got 2 minutes. Oh,
yeah.
Holy moly.
I mean, that was a really good presentation. What do you got?
For 49 seconds.
Yeah. Was it 49 seconds?
Yeah, it was.
Is that the fastest ever?
I think so.
Let's give it up for Blair. All right.
If I had that much time, I'd have kept going.
Do you want to keep going?
No.
Let's give him another minute. Give him another minute, yeah?
No, we're good.
Okay. So this is kind of like OLARC, that kind of thing?
So it's OLARC, but it's fully staffed. So we provide them with a registered, a knowledgeable team. They're actually all registered nurses, but they don't provide advice or diagnose patients. But it is OLARC. That goes on the website. We just staff it for the doctors. It's free for patients. The doctors pay us about $1,200 a year.
The doctors pay $100 a month.
$100 a month.
And have you signed anybody up?
We have 10 doctors. I probably skipped right over that. I was going so fast. But we have 10 doctors right now. We have just under $12,000 in revenue. We've been growing at about 3 doctors a week right now. We're actually going through an acquisition to acquire another 150 pharmacists. That'll probably be done around November, and that'll add about $150,000 in revenue to our bottom line.
How many doctors are there? How big is your target market? How many doctors are there?
There are 853,000 independent physicians. There are 23,000 community pharmacists, and then hospitals is another market for us, and there's about 5,100 of them. That's in the United States. Domestically, we're looking at about 8 million doctors and about 17,000 hospitals.
Is there any kind of regulatory body that you have to deal with in order to do this? Is there any...
So we are HIPAA compliant through and through. There's no regulatory body we have to deal with directly. We do have malpractice insurance, even though we don't diagnose or provide any type of advice. But all of our people who answer these are actually all nurses, and they're all licensed nurses. Mm-hmm. We just basically tap the pool of now stay-at-home moms who don't really want to go in anymore and deal with the hustle and bustle of a hospital.
Sure. And how is this different than calling because I'm sort of accustomed to, if you call your doctor off hours, you call some sort of switchboard or operator service and they hunt down a doctor.
Well,
is this kind of that?
So it's a nurse line essentially, but your independent practitioner, they don't actually have a nurse line that you can actually call. That's only these independent practitioners that work with major healthcare systems. Your plastic surgeons, your behavioral health people, even some of your primary care physicians, they don't have that tool. And a lot of them don't want their people going off to hospitals. They want to retain them there. So this is that way that they can engage with their patient and keep them on their roster and not have them go to Carolina healthcare system and potentially leave them forever or run up a huge tab. What we've realized is that doctors really want to be engaged in their patient's care, but a lot of them realize that they're not technologically advanced to do that, and they realize that they also have to live within a budget. So ours is budget friendly to help them do that. Our price is definitely too cheap, we know that, but we're just onboarding right now.
And is it as simple to install as OLARC? Something
Yeah,
like that?
so it's just a JavaScript code.
Idea?
It takes not even 2 minutes to do. We scrape their website, gather the information for them. We have them approve it, add more information to it, and then we just load it into the back end of our system, and our nurses just disseminate that information to patients.
You're being too nice, I think.
Oh, no, please.
I was asking questions.
I know, there's been so many nice questions. I thought maybe we need a little change of pace.
Yeah.
So I was making some notes about what you had said and some calculations, and I think I missed the how you make money, the revenue model.
Yeah. So
Can you just explain that a little bit better? Are you charging money directly from the patient, or are you charging it to the doctors?
free for patients. Doctors pay us $99 a month, so it works out to about $1,200 a year. The doctors pay us. Patients can use it all they want through the doctor's website. So we get people from as far as Australia coming to doctors' websites and asking questions.
Okay. So one problem that I saw in your presentation is how you describe the market. I was doing some calculations, and it sounds like you're raising money, $500,000.
Yeah.
You said the market is 4 million to 6, growing to a $6 million market.
4 billion growing to a $6 billion market.
Oh, okay. That's a big difference.
Yeah. Yeah, I was like, I wouldn't want you to invest $500,000 for a $4 million market.
Well,
I wouldn't be
that's
here either.
That's what I couldn't understand. How is it possible that I'm going to make my money back?
Yeah,
if
well,
the
we're
market is 6 million.
49 seconds. I'm pretty sure I'd probably.
I didn't believe that was the case.
Yeah.
That I had this whole.
Give me that. So
It's a big market. I wouldn't be here either.
yeah, and you're pricing basically like GoLark is, right?
Yeah, right now it's
Yeah.
99. Yeah.
So there's a thing that I've heard myself say in the past, which is the medical space is where really good technology ideas go to die, right? Because the medical industry, they're slow to adopt new technology.
Oh, yeah.
And like doctors are cheap. They're like, they don't want to spend money on like EMR and all electronic billing and all that. It's all, you have to force it down their throats, right?
Right.
And you got 10 doctors. I suppose you probably know most of them, somehow. No?
So in 3 months in the Iron Yard, I mean, we just beat the street and hustled.
Yeah.
We got, literally, we probably got most of them in the last 2 months, if that.
Right.
The first doctor we signed, it was on a cold call. It was back in June, and we didn't even have a product. I just called him and said, hey, I'm going to put this chat box on your website, and patients can talk with you. And about 30 minutes later, he said.
So there's some things I don't doubt. I don't doubt that I believe that if a doctor did this, they would probably make money on it.
Oh, they make.
Right? I think they would make money. 'Cause
They make good money.
Saving a customer is worth a lot to them.
Yeah.
Right? Getting them to buy this is going to be really hard, I think. What do you think of that?
So what we do now is we just show them the data. This is what your financial performance will be based on some of the other customers that we're doing. This is what the appointments we're going to send you. Basically, how we do is we just account it. What is an appointment worth to you? And they'll say
Right.
$500. This is $99 a month. On average, we're sending 3 new patients your way a week, and that's proven data that we have that we're able to show them through a couple of our customers that allow us to demo and show their product. So, for the most part, for doctors, there are some that are behind the times, but the four focusing ones, they've been the main ones. And you'd be surprised, a lot of the older ones, they like the idea too. Actually, I would say the majority of our doctors are the older ones. They realize that they have to change with times because of the ACA, the Affordable Care Act. They have to provide patient engagement tools. And if they don't get that 5% of people in their patient portal, which none of them are, then they're going to be getting dinged by Medicare. So if we can get people in that portal, which is why one of the big hospitals is talking to us, they say, can you just drive people into our portal? It's boring, it's stagnant, it's one-dimensional, and that's why the interactive piece is so important.
So here's my take. I don't think people are going to be skeptical of you. You seem bright and kind of know your thing and all that sort of deal. And your value proposition is interesting. I think where you're going to need to persuade people that this is a business that can take off is to show them that you can acquire doctors affordably as customers.
Right.
Because there are lots of compelling ideas, software ideas that live in the medical space that the medical industry won't buy.
Right.
Right? And like my default setting, listening to you, is you're going to end up there. And the way to get out of that is find a really advantaged way to acquire customers.
Well,
That's my advice.
we found that avenue of doing that, and I'll just speak to it.
Yeah.
One is direct mailing, and 2 is just acquiring medical web hosting companies. So we're acquiring 150 pharmacy websites right now, and we're doing it on a complete royalty deal. So they're going to take a percentage of the revenue as we grow the business out of that division, and that's going to allow us distribution. They already build the websites, and how we get to customers is through the websites. How we get to doctors is through the website. So that's one means of doing it. The other means of doing it is just direct mail. Doctors don't pick up the phone and they don't read emails. So trade shows and mailing them, we've seen that mailing is hugely effective. So what we're spending
But you can't know. You got 10 customers. You can't know.
So, well, we've actually started mailing this week in our call. So we have 10 customers paying. We have about 22 piloting right now, and we have 6 pending for sales that are actually supposed to pay us by the end of the week.
Yeah, I think you need to get to a bigger number of customers before you can get up there and convincingly say, you know, I know how to do this and
Yeah.
I can raise $500,000. Just
Right.
a little bit longer.
Right.
You need more than 10 customers probably, because
Right.
you're right. You probably got to know the 10 people. You should have gotten to know the 10 doctors you
Oh yeah,
sold
we
to.
know them now. In
Now.
the beginning, we didn't know.
So they're kind of like friendly anyway.
Yeah.
But I think also the same problem that I had, I think that the issue that Chris raised is the issue that I had from an investment perspective, whether it is convincing doctors that this is worthwhile, and that's a tricky thing because they're always in a dilemma of making money and doing good for the patients, and even though they don't admit it, they think they have to think about both. Or sometimes they do admit
Money
it.
overrides that. I've seen that
Sure,
personally.
sure.
Yeah.
But the back of their minds is always the how is this good for my patients? And they don't always have time to think about it in the right business way. So the business logic doesn't always win. But from an investment perspective, the same issue happens. How am I going to be convinced to give you $500,000? Because even though this is a good idea, I'm not sure how defensible it is or how unique it is. And I have seen other businesses do similar things. I mean, there are outsourced services who do this.
Right.
So I think what you need to do is find a way to provide, to explain in a very succinct way the value proposition, your uniqueness in your go-to-market strategy. And I would focus my pitch on that. I mean,
Right.
you know, you threw a lot of numbers, but the truth is, this is a pretty easy idea to understand.
Yeah.
Except for sometimes when you have hearing problems like me, I guess, you don't hear the market size. But other than that, you really had to focus on why is it that you are unique? Why is it that you're different? Why is it that you're special? And what happens is when you don't have something that is so completely unique, the one thing you can always talk about is your customer acquisition speed, the speed in which you're acquiring customers, because that is something nobody can argue. So lacking uniqueness and being similar to other businesses, you have to be able to talk about how fast you're acquiring customers.
Right.
And 10 doesn't allow you that.
No.
So you should, I think, completely focus on acquiring more customers.
That's our focus. So that's a big part
then
of the
talk about the rate at which
acquisition,
you've been
sales,
doing it.
and all that. We just opened. That over the 10 minutes?
Yeah.
Oh, okay. So that's a big part of it. We agree with you. I mean, we opened the round because we were approached, but we weren't planning on opening the round until we were
great.
after 100 customers.
Well, say take the money then. I mean,
Well,
go ahead,
yeah, I
it.
mean, take the money and build, but our thing was let's get 100 customers and then we can go to the market and say, look at this traction.
This
Here
is
you
good.
go.
Good job, man.
Definitely, thank you.
Ahoy,
Nice to meet you.
Thanks, guys.
Nice to meet you, man.